afternoon. Good afternoon. I've been asked to have people take their seats. Thank you very much for being here today. While people have their seats, I will go ahead and introduce myself. My name is Lois Pace. I serve as the Assistant Secretary for Global Affairs here in the United States government in our Department of Health and Human Services. And I am just delighted to welcome everyone here today. Thank you for getting settled so quickly. I really appreciate that. It's my honor to kick off our event, and I'll be serving as your MC today. Initially, we will have a panel of very high-level and esteemed speakers who have joined us this afternoon, starting with the Honorable Javier Becerra, who is our Secretary of Health and Human Services. And he is the 25th Secretary of the Department of Health and Human Services, the first Latino to hold the office in the history of the United States, which is quite important for us here. He also serves as our representative to global forums, such as the World Health Assembly, as well as the health ministerials of the G7 and G20, but also related regional convenings and forums. But even more importantly, throughout his career, Secretary Becerra has made it his priority to ensure that Americans have access to the affordable health care they need to not only survive but thrive, and I know that he's translated that mission globally. He also served as the Attorney General of my home state of California, as well as a member of Congress for 12 terms in our U.S. House of Representatives. And so without further ado, let me please invite Secretary Javier Becerra to the stage. Thank you, sir.
Good afternoon. Good afternoon. Thank you, Mr. President. Thank you. I want to begin by thanking Assistant Secretary Pace for the work that she and many of our colleagues in the U.S. government have done to gather us all together and make this a convening that will produce results. And that is what I think we all hope for. It's my pleasure to welcome you here to the United States for the U.S.-Africa Leaders Summit Health Ministerial Meeting, where we will discuss health cooperation between our various regions. Thank you to His Excellency President Museveni, President of the Republic of Uganda, for your leadership during the recent Ebola outbreak, and for your role in turning the tides towards a successful public health outcome. I'd also like to take a moment to thank His Excellency President Masisi of the Republic of Botswana, as well Her Excellency, former President of the Republic of Liberia, former President Sirleaf. Thank you very much. And of course, honorable ministers and distinguished delegates, thank you as well for your attendance and your participation. Finally, I'd like to acknowledge that there will be two representatives from Congress who will be here. I don't know if they have arrived yet. Congresswoman Sheila Jackson Lee of the great state of Texas and Congressman Stephen Horsford of the great state of Nevada, both of whom will join us today if they are not already here. I thank them. They are former colleagues of mine, and they have been champions on many of these issues on healthcare and our cooperation and partnership with the continent of Africa. The United States and African nations share a strong partnership in health. Together, we have tackled and mitigated HIV/AIDS, tuberculosis, malaria. We've advanced sexual and reproductive health and rights, and maternal, neonatal, and child health. We've closed gaps in nutrition and non-communicable diseases, and we've accelerated efforts towards universal health coverage and the Sustainable Development Agenda. This summit is an opportunity to build on that partnership, including a commitment to and an investment in the health workforce and regional manufacturing capacity, two priorities that we have heard from regional and country leadership. Throughout the Biden-Harris administration, we have shown a commitment to Africa that can be measured not just by words, but by deeds. Since the beginning of this administration, the United States has invested and committed to provide nearly $20 billion in health programs in the Africa region. We have worked closely with African partners throughout the COVID-19 pandemic to get vaccines into arms and save lives. We provided more than 230 million doses of COVID-19 vaccines to African nations to protect their citizens and are supporting new regional efforts to produce vaccines made by and for African. We made an initial commitment of $450 million to the new pandemic fund announced at the G20, and we are committed to championing equity as we face future pandemics. And we committed to strengthening the global health architecture to address global weaknesses exposed by the pandemic, working jointly with your governments to update the international health regulations and develop the terms of a new pandemic accord. Now, today, we're announcing $215 million in new funding to address COVID-19, the pandemic, in Africa, which will allow us to do a number of things. Continue our work to accelerate widespread and equitable access to and delivery of safe and effective COVID-19 vaccinations. Reducing morbidity and mortality from COVID-19. Mitigating transmission and strengthening our healthcare systems. Furthermore, we have made mutual commitments to the Global Health Security Agenda, the GHSA. For example, the U.S. is supporting 19 partner countries to strengthen their health security capacity and help them set up to achieve the HSA 2024 target. African countries have played and continue to play valued roles in GHSA as steering group members and by hosting the 2017 GHSA Ministerial. Finally, in the 7th GHSA Ministerial meeting, participants endorsed the new Seoul Declaration, extending the GHSA for a third 5-year phase. We will continue to look to regional leadership as we head into GHSA's next phase. As my father used to say, those who work in construction often will repeat this as well. If you want to build something sturdy that lasts, you have to lay a strong foundation. The bedrock of our foundation is our partnership, and together we are making significant strides. As we work together to respond to existing and new health threats, from HIV/AIDS to Ebola, our long-term relationship is focused on long-term investments and collaborations that support African leadership now and into the future. While our accomplishments have and will continue to save many lives, we must commit to creating a system that is strong and flexible, and one that will meet the future public health challenges that we will face together. Moving forward, we also know that health is not just about pandemics. It includes important ongoing health priorities and challenges such as malaria and maternal health. That's why the President was proud to host the 7th replenishment of the Global Fund to fight AIDS, tuberculosis, and malaria, which, thanks to the historic contributions of many of you, has raised nearly $16 billion in pledges to date. We also join many of you as champions of universal health coverage, an essential policy in support of equitable access to care and services worldwide. We must work together to make up lost ground due to COVID-19, including fallout in routine childhood immunization around the world. We must ensure that critical services are available to those most in need, including those affected by humanitarian crises, and the more than 2 billion people affected by conflict around the world. And we must prepare communities, especially those at highest risk, for the effects of climate change. Across these challenges, we will continue to champion the rights of historically marginalized individuals and communities, including LGBTQI individuals, to ensure we do not leave anyone behind in our progress. As we enter this new phase in the global health order, We must remember that strong and inclusive health systems from the foundation upon which we will build any effective response to new or ongoing health challenges. But as you know, we still have much to do. You can count on us to continue to team up with countries in Africa and across the world, alongside partners, including the World Health Organization and its regional offices, the African Union, and the Africa CDC, to build the infrastructure for better global health outcomes and bolster security. Something I know my father, if he were still here, would be proud to know. I'm confident that with your help, our teams of architects will continue to build a stronger global pandemic preparedness system for future generations, and we are going to build something that lasts. I hope we can all continue to learn from one another and work together, because healthier populations and stronger systems everywhere make us resilient and more prepared for the challenges to come. As we also vividly learn from COVID, none of us is safe until all of us are safe. Thank you all very much. Let me now hand it back to Assistant Secretary Pace.
Thank you very much, Secretary Becerra, for opening this session officially with those remarks. Now it is my honor to introduce His Excellency, President Yoweri Museveni, who is the President of Uganda. He became President of Uganda in 1986 and has a number of accomplishments that we could applaud, not only in health, but also in economic issues such as debt relief, as well as education, such as affirmative action for women to achieve and receive higher education. I know that he studied political science and economics in his schooling, and in addition to those degrees, has a Doctor of Divinity as well as a Doctor of Laws. And so we are grateful for your presence, sir. And with that, welcome you to the stage, Your Excellency.
The Secretary of Humanitarian Services, His Excellency the President of Botswana, other dignitaries. In Uganda, we approach health with two strategies. Just, I imagine, as it is done in many countries. The two strategies for health are preventive health care on the one hand, and curative health care in case somebody gets sick. Prevention, number one, cure if you can't prevent. That's our strategy. The preventive health care includes the following. Number one, nutrition through sensitization and education, because Uganda does not lack food of any type, carbohydrates, proteins, fats, vitamins, and other micronutrients. What is sometimes lacking is knowledge of what is needed and why. Consequently, some people overeat, others undereat, and others miseat. In other words, eat what they do not need and fail to eat what they need. Income inequalities, especially in the towns where there are unemployed persons that no longer have access to land, sometimes causes malnutrition. Because in Uganda, most families have land. It is not like in other parts of the world where many people don't have land. In Uganda, it is the other way around. Almost everybody has land. So those who have land, they grow their own food. So the problem is not food, it is to know what food to eat and why. So the second preventive measure is hygiene. Hand washing, proper waste disposal, including latrines and waterborne sewage systems. This eliminates many diseases such as cholera, intestinal worms, hepatitis A, etc. Number 3, safe water through boreholes, gravity flow schemes, protected springs, and piped tap water that eliminates many waterborne diseases such as cholera, worms, guinea worms, bilharzia, and other hazardous contaminants like heavy metals that can lead to cancer. Number 4, vaccination that prevented smallpox and vaccinations that prevent the following diseases: polio, severe forms of TB, tetanus, whooping cough, diphtheria, hepatitis B, cases of pneumonia, severe diarrhea, yellow fever, and HPV. And HPV is against cervical cancer, in our young girls, and COVID-19. Number 5, malaria prevention through the use of larvicides. If we could concentrate on that line, larvicides, killing the larvae of malaria or of mosquitoes before they become mature mosquitoes. Draining of stagnant water, because Uganda has got a lot of water. 20% of Uganda is under fresh water. So that water is good for us, but also good for our enemies. So if we don't work on it, it can be a problem. The use of treated bed nets, etc. Number 6, behavior change that has helped us to deal with HIV/AIDS, because this is a behavior problem, mainly. AIDS, you go and look for it, doesn't look for you. Corona-19, again, this is partially a behavior problem, but especially Ebola. I'm glad the Secretary was recognizing our recent little victory against this Ebola. When this Ebola came up recently, there's a new clan. There are different clans of Ebola. There is Ebola Congo and Ebola Sudan. So the one which visited us recently was Ebola Sudan. And people were panicking. I say, but why are you panicking? This is very simple. This disease does not attack you unless you come into physical contact with the one who has got the virus. And not just casual contact, intimate contact. Because it goes through a few places. If the Ebola virus falls on your arm here, it will not affect you. It will not affect you if it goes into the eyes, the nose, the mouth, or through sexual interaction. So I told our people, but you know how the Ebola is going. Let's stop it. They were running around, but we stopped it. It's not such a big issue. Number 7, lifestyle diseases, such as hypertension, diabetes, heart attacks, kidney diseases, cancers, alcoholism, etc. These can be prevented in many cases by appropriate conduct, e.g., not overeating. Why do you eat too much? Not smoking, not taking excessive alcohol, and exercising, etc. Number 8, this is all in the prevention. Protecting the environment, especially the quality of the air, that can help us to prevent some of the respiratory canal diseases. Some of the pollutants can go through food chains, e.g. agrochemicals. Polluting water sources becomes therefore crucial. Those sources must be protected by ensuring that there are vegetation belts around the water bodies, e.g. forests, shrubs, etc., to make sure that we leave vegetation belts around the lakes, around the rivers, around the wells, so that they can filter out for us all these pollutants. By being serious on the above 8 points, if you are serious on these 8, which I have listed here, you eliminate 75% of all possible sicknesses that can afflict our people. That then leaves us with the 25% to deal with. It is here that now the curative network of our medical centers comes in. In Uganda, we have what we call a health center 3 per sub-county. And there are 2,184 sub-counties in Uganda. Then we have health center 4 at the county constituency. And there are 353 parliamentary constituencies in Uganda, out of which 167 have the health center 4s. We call them health center 4s. A constituency has around 100,000 persons. The third tier has a district hospital. This should be 147 in Uganda. However, we now have 45 of them. There are then the regional referral hospitals, which should be 21. We now have 16 of them. There is then the National Referral Hospital at Mulago, plus other specialized national health assets such as the Women's Hospital, the Joint Clinical Research Center for AIDS. All the above are government health facilities. There are, however, many private health facilities belonging to private people, to the churches, to Islamic groups, to private people, both local and foreign. We are now working on eliminating medical referrals abroad, because we have been having that problem of our people going to India, especially, and recently to Turkey. We are trying to eliminate that. referrals mainly for heart, kidney diseases, and cancers, and sometimes involve organ transplants that have been taking US dollars 70 million from Uganda per year. Those referrals have been taking quite a bit of money from the country. We are going to we are going to reverse medical tourism. Instead of our people going out, we want people to come into Uganda by providing this super specialization service to patients from abroad, also taking advantage of the good high altitude climate of Uganda for the recovery of these patients. Because where they go, the climate is not so good. So when they recover, I think they will recover faster if they're in Uganda, because the climate is very good. Uganda's elevation is between 600 to 21 meters above sea level. So when I land in Washington, I get worried because I see on the computer of the plane that I'm 18 feet above sea level. I get really very worried. So Uganda is between 621 meters above sea level and 5,119 meters above sea level. That is why you find permanent snow on the equator. The picture of the Rwenzori here clarifies that point. In my statement, you will see the picture of the Rwenzori with permanent snow right on the equator. Uganda is therefore moving well on the issues of health. The pressure is to cause our doctors in the districts and nationally to put more emphasis on public health, avoid the sicknesses, instead of waiting for people to be sick and then get treated. This has been part of the colonial training of the doctors. The doctors, the way they are trained they were trained in the past, it was for them to ambush the diseases, wait for people to be sick so that they are treated. But why do you wait for people to be sick? Why don't you stop it? This is our emphasis. They have that orientation. We are trying to convince them to please educate the people so that they don't get sick instead of waiting for them to be sick. That is how our population has risen from 14 million in 1986 to now more than 43 million. The population in 1986 was only 14 million, but it is now 43 million, and it will be 106 million by 2050. So don't worry about this population. I know some people are worried about population, but Africa has actually been underpopulated. So when you are worried about population, don't worry about Africa. Africa is 12 times the size of India. You can put India into Africa 12 times, and it will fit there. Until very recently, the population of India has been bigger than the population of Africa. It is only now that for the first time, the population of Africa has overtaken the population of India. So you can see that really the population the problem of Africa is not overpopulation, but rather the other opposite of underpopulation. This population of Uganda, which has risen more than almost 4 times in 30 years, we have no problem with it. It's not such a big issue. There are 2 areas where we are moving on our own, but where we would welcome collaboration if available. This is in the areas of pharmaceuticals and vaccines. It is not correct to continue with the present arrangement where in the global share of pharmaceutical production of US dollars 1.42 trillion, Africa's share is only US dollars 16 billion. of the pharmaceuticals produced in the world, valued at 1.42 trillion, Africa's share is only 16 billion production. Uganda and Africa are better placed to produce many of the pharmaceuticals on account of the plants that we have in our area. Chinkona, which helped humanity with malaria from the year 1630, was a tropical plant. There are other sister plants in the tropics that can help man with many of the health problems. During the Corona-19 pandemic, one of our professors, Professor Patrick Ogwang, cross-matched an ancient antiviral plant product that our people in the northeast of Uganda, Teso, have been using since time immemorial against measles caused by the virus rubiola, with the treatment for Corona-19 virus. And it saved so many lives. This professor from the village knowledge, traditional knowledge, his education about viruses and so on, when this virus came, we said, oh, but we have got something we use for the other virus, the measles. Let me try it on corona. And it just kicks it out. Just kicks it out. Uganda, with a population of 43 million, had 170,000 cases of Corona-19. And we lost 3,632 people. You very well know what happened in other parts of the world. You know how many people died. Many more than this one here. We are also working on developing all the types of vaccines needed for the humans and for the livestock. Our scientists have, for instance, discovered an anti-tick vaccine recently. On the side of the diagnostics, we are moving well, as we are doing on the side of sanitizers. Being one of the biggest producers of bananas in the whole world, since ancient times, it was easy to enhance the production of sanitizers from the alcohol base and from bananas. In the Great Lakes countries of Kenya, Tanzania, and Uganda, you even come across many names of marwa, wamarwa. When you hear that word marwa, wamarwa, it means alcohol, all referring to alcohol from bananas or from sorghum and millet. So we are able now to upscale this alcohol, which people are using to burn their livers, to instead burn the virus. That's how we're able to get the sanitizers. In conclusion, from Uganda's point of view, we invite friends like the United States and brothers like the African brothers who are here to cooperate with us in the production of vaccines and pharmaceuticals for the improvement of global health. Collaboration between the USA and Africa will enable the world to get cheaper medicines and vaccines. Because remember, our production costs are lower. Our production costs are lower. So if you want cheaper drugs, the place to go is Africa. In our research for vaccines development, we found that we need 17 input chemicals and reagents including the one known as beta-propiolactone. When we're developing these vaccines, we find we need chemicals and reagents. And one of them is this one. Because I take close interest in this, you may think that I know something about chemistry, but this is just plagiarizing, stealing the knowledge of others. And when I speak, people think, oh, the man is informed. Our scientists told me that this was from cassava that was produced in Uganda. So we were running around, ringing labs here, get us beta-propiolactone. Oh, what? But where is this made from? From cassava. Cassava. But we have it is not correct to produce unaffordable medicines on account of using expensive inputs when countries like Uganda can produce those inputs cheaply. Our part of the world, the Great Lakes area, had little contact with the outside world until 1841, when an Arab man by the name of Ahmed bin Ibrahim became the first non-black person to come to our area. We had never seen a non-black person until 1841 when an Arab came. And people looked at him. They didn't know that he had a skin. They thought he had no skin because he was the first non-black people they saw. So in those times, people were traveling by ships and walking on foot for 1,000 miles from the ocean. That slow way of movement, nevertheless, did not stop those travelers bringing the terrible smallpox called Omuze, Ebkacha, Kawari in our languages in 1894 that killed so many people. Those travelers who came from outside brought us terrible smallpox in 1894. If epidemics could spread in spite of the slow pace of movement of those days, how about now when people can hop from continent to continent in a matter of hours by aircraft? The recent phenomenon of COVID-19 has clearly shown this. This therefore means that especially with epidemics, like the Secretary said, the health of one is the health of all. I thank you, Your Excellencies.
Thank you very much, Your Excellency, for those remarks. We have an expression here that we use that perhaps is used in Uganda, that an ounce of prevention is worth a pound of cure. So I'm grateful for where you started, and also grateful for where you ended in terms of a call to action with regards to how we might partner. So we're hoping to talk more about that through the panels that we will be hosting today. But before then, I would like to now introduce His Excellency President Museveni Masisi of Botswana. He is the 5th and current president of Botswana, serving since 2018. And he, before entering politics, spent a number of years in education, in teaching and administration. And so we are grateful for his service on a number of fronts. And again, before those political positions, he served in many capacities, but in government, he has been able to serve as Assistant Minister for Presidential Affairs and Public Administration, as Minister of Education and Skills Development, and then finally as Vice President before his current role. And so, Your Excellency, we welcome you to offer your remarks as well. Thank you very much for joining us.
Director of Ceremonies, Secretary, Mr. President, and distinguished guests, ladies and gentlemen, a very good afternoon. Good afternoon. Thank you. Let me begin by first expressing my gratitude to His Excellency President Joseph Biden for convening this second meeting of the United States and African leaders to take stock of efforts made to respond to the COVID-19 pandemic. I must also hasten to underline the importance of relations between the US and Africa, which are critical to economic recovery across the whole continent. And we also are grateful for the lessons we both learned, because clearly the US has chosen to reset its relations with the African continent. We remain eternally grateful given where we are from, which wasn't the best place to be. I think the topic and discussion is appropriate, given that this session is focused on partnering for sustainable health cooperation and health security. It offers opportunity to engage in a dialogue to safeguard global health security towards attainment of sustainable development goals. The focus of the session is timely, given that the persistent indices of ill health, poor quality health systems and services, particularly in low-income and middle-income countries, as well as premature deaths and infirmities caused by outbreaks of diseases, can quickly evolve into pandemics, which also raises the specter of global solidarity for universal health. Yes, we all were pretty saddened by the unwelcome disruptions caused by the COVID-19 pandemic over 3 years, which resulted in enormous loss of lives and economic hardships around the globe. But it not only exposed the vulnerability of the healthcare systems, COVID-19 also presented health challenges to survivors. It left economies vulnerable. It compromised food security and nutrition. It caused loss of income and worsened unemployment. It deepened inequalities within and between states. It contributed to both reduced access and lower pass rates in education, and created rising cases of depression as social life was affected by restrictions of movement and isolation. There is a measure of comfort that some of these interrelated issues and adverse effects, which require collective action and global solidarity at all levels, will be discussed during this summit. I'd like to bring you up to speed on Botswana's swift response to the health, economic, and social impact of the COVID-19 pandemic, key to which was elevating the COVID-19 response to the highest political level through the establishment of a presidential task force whose mandate was to provide oversight in the multi-sectoral coordination of the COVID-19 response. We are aware that there are cases with other countries. As was the case in other countries, Botswana declared a state of emergency and movement restrictions very early on. We also undertook public health prevention measures, such as the wearing of masks, the sanitization or washing of hands, social distancing, and the Ministry of Health, the professionals, provided the full guidance for that. I might add that, with no pun intended, Botswana is the longest continuous democracy in Africa, multi-party democracy in Africa. But we deliberately, because of the limitations of our statutes, could only limit the rights of persons through the declaration of a state of emergency, which ended up being the longest state of emergency we've ever had, over 18 months. Now, to counter the impact, the economic impact of COVID-19, such as a shortage of food supplies and basic commodities, we had to also intervene to avert the impacts of job losses. And in doing that, government undertook or introduced a COVID-19 relief fund in April 2020, which had an initial capitalization of 2 billion pula. That's approximately, what, 75 million US dollars, which covered wage subsidies, waivers, loan guarantees, and payment deferrals. Government recognized very early on that the poorest and the most vulnerable groups in Botswana, including the elderly, people with disabilities, people living with chronic illnesses, and those living in remote and rural areas, among others, were most at risk of being impacted by the COVID-19 pandemic. And as such, Botswana implemented a substantial COVID-19 food relief program in order to provide the necessary assistance to those in need. I must emphasize that specific to the medical response to the pandemic, Botswana, with the support of both local and international partners, implemented a robust COVID-19 vaccination strategy which prioritized those most at risk. As a result, vaccination uptake in Botswana currently stands at 81% of the general population who have received at least one dose of the vaccine, and 70% having received their primary series, which is a key milestone that we reached in our response. I must also hasten to add that it didn't come cheap. We literally emptied our bank accounts to buy, pay for in advance, and painfully, the vaccines didn't come, nor come on time. They came late, for 2 minutes too late. And that's when we resolved to reset. And it's one of the major reasons why I am here, and I bet President Museveni is here. We have resolved that we never want to be caught in that space again. So we moved swiftly to reinforce the disease response mechanisms by implementing the WHO Regional Strategy for Health and Emergencies 2022 to 2030. We also developed a National Public Health Institute, which is at its initial stages of establishment, but once fully operational, it'll coordinate the public health emergency preparedness and response in the country, including the implementation of international health regulations of 2005. Botswana was also in the process of establishing a public health emergency operations center. And I wish to stress that all these efforts will strengthen the prevention, the detection, and response capacities of the country to improve health outcomes. In the long term, of course, a solid basis for attaining resilience and security in Botswana's health systems will be the development of national capacity for pharmaceuticals production. Botswana's desire and intention to become one of the nations that manufacture vaccines, like Uganda, medicines and other healthcare products, and test kits to advance the quality of our healthcare systems and therapeutics is advanced. And I'm happy to inform that we've partnered with NantWorks out of California, and the first series of COVID-19 vaccines is being developed, currently produced out of India. We're preparing our clean rooms, and we're training our persons to be able to produce those and other tropical diseases that have been neglected for too long in Botswana for our own use, but also for the use by the world. And America, we won't forget you too. I want to note the achievements of the Access to COVID Tools Act, or ACT, Accelerator, and the African Union's AVAT vaccine platform. Botswana participated in the COVAX pooled procurement mechanism as a self-financing country, as well as in the African Union AVAT vaccine platform, and received donations later through bilateral partnerships, including from the United States of America, which we greatly appreciate. There are a number of COVID-19 vaccines, whereas there are a number of COVID-19 vaccines which were successfully developed in record time, the main challenge was, as I said earlier, the timely and equitable access to vaccines by all countries. Added that this disparity also applied to personal protective equipment, to oxygen, diagnostics, and effective and affordable therapeutics and medications. I'm pleased to inform you that in the region of Southern Africa, we actually now have an oversupply of oxygen. And our innovators in our various tertiary institutions have done remarkable work in generating and developing new responses to appliances we didn't have before. I'd want to ask that we establish and we strengthen local production, particularly in the African continent, and we seek your support and partnership, your friendship, your solidarity, and comradeship. This, distinguished ladies and gentlemen, is premised on the reality that Africa produces less than 1% of its total required vaccines and medicines, which undermines our health-related sustainable development goals. And they're not my country's, they're not Africa's SDGs, they are our SDGs. The African region has a huge potential of human resources, particularly young, skilled, upwardly mobile, curious, energetic, and very, very ambitious people who just need to be adequately capacitated and supported with appropriate skills and technology, including for research and development, in order to take these initiatives forward and therefore contribute to the improvement of global public health. We as a region have the requisite human capital and research institutions which could be scaled up with the support and collaboration of our development partners. And it's these that Africa shares good bilateral relations with and also partner at a business-to-business level. It's the second reason why we're here. We seek your partnerships at the governmental level. We seek your partnership at the business-to-business private sector level. I need to remind you, delegates, that scientists in Botswana and our neighboring South Africa, in that order, were the first to isolate and sequence the COVID-19 variant, later known as Omicron. Botswana and South Africa, in that order. Sorry, I had to say that because it doesn't often happen like that, you know? Gosh, you should have seen me jump out of bed that morning. Yeah, we have a stellar scientist called Dr. Moyo, who gladly was trained through our Harvard partnership. And so we have taken a step forward from the lessons we learned from work that we did together so well and successfully in the sphere of HIV and AIDS. And we're moving forward with that. We also want to emphasize that financing and sharing of intellectual property and the know-how is equally important. This is in line with the decision reached at the WTO regarding the intellectual property waiver as required. I am satisfied that building manufacturing industries for vaccines and other medical countermeasures is prioritized as one of the areas for cooperation between Africa and the United States. And as a point of illustration, let me point out how particularly important it is for the United States because it's advanced so much in the pharmaceutical industry that we partner with yourselves. My government, as I said, has partnered with Dr. Patrick Sonshu out of California and his company NantWorks, and he's developed, established a company in Botswana, which was launched in March of this year, called Nant Botswana. We will produce COVID-19 vaccines, but also produce cancer treatment drugs and next-generation cell-based immunotherapy, among others. You know, the growing of T cells and all that. I'm trying to sound as impressive as President Museveni too, because I've been briefed on all this. Let me share with you also that we believe deeply in partnerships at all levels, from the community to the international level. We want to employ a whole of government and a whole society approach, which are crucial approaches and central to achieving our common goal and agenda for global health security, as each pandemic knows no borders. You can't even build a wall for this one. I'd like to reiterate the importance of financing of the national and international health systems, including the strengthening of core capacities of the international health regulations as a global public good, and the achievement of universal health coverage, which cannot be overemphasized. I'd like to take note of the importance of building human resources for health as key and central. So whatever partnership we come up with, it is important that we build the requisite human capital for the long haul. Botswana is following with great interest the development of the recently launched Financial Intermediary Fund. And we thank the United States for its leadership in setting up this fund. It will provide, indeed, the critical investments to strengthen public preparedness, pandemic public preparedness and response capacities at national, regional, and global levels, with a focus on low and middle-income countries. I want to, once again, applaud sincerely and welcome the United States of America's strategy towards sub-Saharan Africa, launched by Secretary of State in August 2022, which is a testament to strong bonds of friendship between the United States and Africa. And I read it personally. It's most gratifying and refreshing. The priorities of this strategy are in line with Botswana's immediate and long-term economic recovery and growth. I want to commend the initiative by the G7 for a funding goal of $600 billion to rival China's Belt and Road Initiative. It's really refreshing to come from America because your biggest believes in competition, and we love competition. In conclusion, I want to reiterate Botswana's commitment to the implementation of this strategy and support the resourcing of the established structures, institutions, and programs for its implementation, including through partnerships, both within the region and with the United States of American government, civil society, academia, and the private sector. And in Botswana, you have found a long-term, reliable partner. Thank you. Thank you.
Your Excellency, that was quite inspiring, what you shared. As you said, we cannot be here again, and I just want to say, on behalf of our government, that we thank you for trusting us to reset and appreciate your openness to how we move forward. I think you'll be encouraged, in fact, by the next panel, which I now have the pleasure of introducing. I would like to honor the Honorable Minister of Sierra Leone, Dr. Austin Dinby. He's their Minister of Health and Sanitation. And the role that he is in now, while it is a very important one, follows a career in our U.S. government. And so I know that Minister Dinby holds a special place in our hearts here in Washington. Thank you for your work and for your service, both in the Republic of Sierra Leone and also with the CDC and PEPFAR. With that, I turn things over to you.
Thank you very much, Assistant Secretary Pace. This is a really pleasing moment for me to come back to Washington, D.C. And to meet with family, extended family in HHS. I'd like to introduce the panel for today, starting with the Honorable Junga Dungu, the Cabinet Secretary, National Treasury and Economic Planning of Kenya. I believe he's on his way, but we'll save a space for him. I'll also like to introduce Dr. John Nkengasong, the U.S. Global AIDS Coordinator and Special Representative for Health Diplomacy. John? I'll also like to introduce Chidima Mpefe, who is the Director for the African Medical Supplies Platform. Chidima? Well, thank you very much. I think with the incredible lead from His Excellencies, the two presidents, we want to follow up with some of our thoughts around partnering for sustainable health cooperation in the health sector. So I'll start by just my small experience in Sierra Leone. We have a situation in Sierra Leone where in 2014 to 2016, we had the Ebola outbreak. We lost about 4,000 people. We had about over 14,000 infections. It's unbelievable. We're still recovering from that. But one of the things that worked out well for us was the solidarity from the rest of the world that came to join us to fight Ebola in Sierra Leone. And by the second year, our collective effort led us to actually conquer Ebola. So I want to say thank you to the world for all of that help. I want to single out in particular the United States of America because the U.S. sent 1,500 healthcare workers to help us support that effort. So in that same spirit of solidarity, I want to commend our colleagues in Uganda, and thank you, President Museveni, and thank you to my colleague, Minister Ruth Ocheng. We've seen that in these partnerships, solidarity is critically important. What we saw in Guinea in 2021, February 14th, after Guinea declared an Ebola outbreak there, the whole world, all of Africa rallied behind Guinea, and we were able to crush that outbreak in the shortest possible time. So thank you to the world, and thank you to that solidarity. We'll hope that we could conjure that same spirit to work with Uganda to be able to crush this outbreak there, because containing and crushing the outbreak in Uganda saves the rest of the world. Thank you very much, Dr. Ruth. So in that spirit, I have a couple of questions for my colleagues in the panel today. We were looking at discussing ways of sustainable financing, innovation, and health system strengthening that could mutually reinforce health security and protect against health shocks. My first question is to you, Ambassador Nkengasong. Ambassador, how can diverse disease-specific investments like PEPFAR HIV/AIDS investments be leveraged to support efforts to develop and maintain health security capabilities and capacities and broader health system strengthening, building resilience to health threats and shocks, and promoting economic resilience?
Thank you, Minister Dembi, for your leadership in what you are doing in Sierra Leone. Let me, first of all, start by recognizing our Secretary of Health here, Secretary Becerra. Thank you for those warm remarks. President Museveni, for your long-time leadership in the fight against HIV/AIDS, and President Masisi for your leadership in Botswana in making HIV/AIDS, turning the tides against HIV/AIDS in your country. The topic of this present session is sustainable health cooperation. I think if there's any one area that the United States government has worked very closely with the continent of Africa, I think in my 30 years experience in public health, it is in the area of HIV/AIDS. Over the last close to 20 years, the United States government has availed more than $100 billion to fight HIV/AIDS on the continent of Africa. The two presidents here, President Museveni, President Masisi, recall very well how devastating HIV/AIDS was 20 years ago on the continent. It was a security threat. It was a serious developmental threat. It was a serious economic threat for the continent. Today, thanks to the investments through PEPFAR, the U.S. President's Emergency Plan for AIDS Relief, the tides have changed together with the Global Fund. I think that is a good example of a concrete example of what collaboration, effective partnership looks like. And in that, about 25 million lives have been saved, 25 million lives. 5.5 million children have been born free of HIV/AIDS thanks to the PEPFAR investments. But very importantly, I'd like to recognize the leadership of the two presidents here. Botswana, when we met at the International AIDS Conference in July, was the first country in Africa that had exceeded the goals to achieve 95, 95, 95. What does that mean? That 95% of people who are infected know their status, 95% are put on treatment, and 95% suppress their viremia. That was the major news at the AIDS conference. We continue to believe that that kind of partnership is extremely important to bring HIV/AIDS to an end by the year 2030, which we should be very careful that we do not leave our eyes off the ball of HIV/AIDS, which is still a serious threat. The UN AIDS reports that were just published on the 1st of December point to the fact that we are beginning to see HIV/AIDS creep back. New cases of HIV/AIDS are coming up. So we really need to continue to work with the presidents who are here and others in Africa to make sure that that trend continues across the board. But the PEPFAR platforms that have been put in place over the last 20 years are a serious health security platform to respond to other diseases. We've seen during this COVID outbreak, the pandemic, how PEPFAR platforms were used to roll out diagnostics, were used to supporting vaccination programs, were used in community health workers that were very skilled in HIV/AIDS response, were very effective in the response against COVID. So that is a unique platform that we've developed over the last close to 20 years, and we can continue to leverage on. Let me just conclude my remarks by saying that on the 1st of December this year, we released a new strategy for PEPFAR, which really focuses on strengthening health systems, but taking a closer look at manufacturing of health-related commodities, especially in Africa. If you look at that strategy carefully, we are saying PEPFAR is ready to work with countries in Africa so that diagnostics can be made on the continent, and PEPFAR is committed to buying made-in-Africa diagnostics. Secondly, that PEPFAR is committed to working with countries in Africa so that made-in-Africa antiretroviral treatment can be purchased by PEPFAR and together with Global Fund. So I think I'm very delighted to hear the two presidents elevate that conversation around regional manufacturing. We believe in PEPFAR that in the new strategy that by doing that, it is really a direct way for ensuring regional health security and global health security, because we cannot have global health security without regional health security. Thank you.
Thank you. Thank you very much, Ambassador. My next question is to Chidema. In your experience, what are some best practices to promote, actually, no, this is really intended for Kenyan colleague. But I'll go back and just say, what are some technologies or other innovative approaches we can invest in today that will strengthen health systems and healthcare delivery during peacetime in a manner that increases resilience to future emergencies, including through improved health security and pandemic prevention, preparedness, and response capabilities?
Thank you, Honorable Minister. Thank you as well to Excellencies, the President and the Secretary of Human and Health Services for having us on the platform today. When I think about innovation, I often sort of describe innovation as the ability to find new ways of doing old things. So when I think about innovation in that context, I guess there are three ideas that come to mind on how we could approach this. And interestingly, there's a common theme from the remarks from the President, from the remarks from Dr. Nkengasong. And for me, the first pillar, the first idea, is centered around accelerating African manufacturing of medical commodities. And on this point, honestly, as a continent, we need to diversify our pharmaceutical supplies. And with manufacturing that is based on the continent, what we will hopefully start seeing is marked reduction in actual prices of medical commodities that's driven by the presence of these manufacturing entities on the continent. This is remarkable for us as a continent because we are also historically plagued by economic concerns. So one of the things that we need to be leveraging is finding new ways of, working on the supply security or the health security situations on the continent without necessarily, taking away from the quality of healthcare on the continent. One other thing that is also related to this accelerating manufacturing capacity on the continent is really operationalizing the regulatory harmonization framework for the continent. We must, as we talk about this acceleration of manufacturing, we must simultaneously be discussing how we can unlock and operationalize regulatory harmonization. Because as we all know today, it's still quite fragmented and it poses a severe risk for that particular pillar. The second idea that often comes to mind when I think about innovation and the current landscape and the ecosystem on the continent is centered around co-creation. Honestly, for me, co-creation is such an enabler of medical innovation. And we must be deliberate about how we approach this. So for me, every time I think about collaboration, I often wonder, why are we not much more involved? Why are we not approaching this why are we not deliberate about approaching this? Because the benefits are immense. We're talking if we are able to create solutions that are unique to the target population, we can definitely unlock greater benefits and more positive health outcomes for the continent. And honestly, if we start talking about the opportunities of creating these unique products and services for the continent, I honestly think it's going to be mutually beneficial for not just the financing entities like donors, philanthropies, but even for the governments themselves. We've heard today from our excellencies, there is such a huge appetite to strengthen Africa's own system. So co-creation literally means to me spurring, more investment into research and development, more investment into actually creating those infrastructures at a regional and at a local level. And the third idea, the third pillar, which is a low-hanging fruit, in my opinion, is really increasing and widening partnerships with regional and local organizations on the continent. I'm sure we are all aware, but recently, or maybe in the last couple of years, we've seen tremendous innovation happening across the continent that's driven by mobile and digital adoption of some technology advancements. And we see this cutting across a wide spectrum of the healthcare supply chain. We see it in, how patient education is happening today. We see it in even supply chains and procurement. We also see it in disease management programs. So innovation is happening. There is capacity. What we need to really unlock at a full scale is targeted and deliberate partnerships. And this, I believe, it's going to help. I mean, we need to have deliberate commitments to building this local capacity. Oftentimes, as we work on the continent, I hear people say, oh, we don't usually will give this to you because there is no capacity. Have you looked at what we're doing? Have you looked at what we're doing? There is a lot of work. And just taking a step back and looking at African Medical Supplies platform, we are a digital pool procurement agency that basically we're leveraging our collective purchasing power to negotiate better rates of medical consumables for the continent. So if you look at the kind of work, the scale of the work that we're doing on the continent, it's almost crazy for me when people say there's no capacity on the continent. There is capacity, but do we need to further upskill that capacity? Yes. Do we need to further strengthen what that capacity is able to achieve today? Yes. I mean, if you could even put it in a different way, we need to move away from the legacy systems where, we get partnerships that develop for Africa. What we need to happen today is partnerships where we are working with Africa to develop Africa. Thank you.
Well, thank you very, very much. It looks like we have an ideal panel here where you could actually speak to each other on these issues. It's incredible, Ambassador Kengasong, when you say with all of the investments with PEPFAR, that there is going to be a specific shift now to look at diagnostics and looking at treatment and looking at local manufacturing. And I think what we're hearing from a colleague is, you really want to make sure that the regulatory framework is there and to be able to better manage this process and to ensure also that there is co-creation that's going on that will allow ownership and perhaps looking at the nuances at the local level. So this is incredible. So I was just wondering, based on the kinds of thoughts that you've heard from the platform, are there opportunities here for a much stronger partnership between PEPFAR and the U.S. government and the medicines platform that our colleague just talked about?
Yeah, absolutely. I think there's huge opportunities for partnerships and very practical partnerships. During the COVID pandemic, which is still ongoing, one of the most important innovations in terms of the continent of Africa responding to the threat was innovation made out of the Afri-Exim Bank, which is the African Export-Import Bank in Cairo, where they made two important innovations and exercised greater leadership. One was the support in establishing the African Medicine Supply Platform, which if you Google, you pull out your phones and Google AMSP, you will show up like Amazon.com, and you can actually go in there and shop for products there. Second was enabling the vaccine acquisition. His Excellency President Masisi talked about the AVAT platform, the African Vaccine Task Team. And that was achieved because the Afri-Exim Bank enabled $2 billion for the continent to purchase vaccines, the 400 million doses of vaccines. So why is this relevant in this partnership? As we discuss the pandemic fund, I think those are instruments and opportunities for partnerships that can be leveraged. So we learn lessons on how the continent, the Afri-Exim Bank and others, and Chirima did it, and then build partnerships. Partnerships that will not be a partnership of the United States donating to Africa, but strengthening and truly cooperating and enhancing those instruments and architectural systems that were put in place during the COVID response. That is my hope, and wish that a lasting partnership is a partnership that the continent has a stake in it, and they already demonstrated that.
Well, Marcel, that's just brilliant. So, Chilima, you have any reaction to that? Because clearly you're speaking to each other. It looks like there's such complementarity and a feeling that the Africa of today and of the future is a forward-looking Africa that's looking at innovations that are built from within and for us. And the partnerships that you're looking at is real mutually beneficial partnerships rather than a donor-recipient relationship. So what's your reaction to Ambassador?
Honestly, just to kick off, Ambassador Kengasong is the founding partner for AMSP as well. AMSP was really conceived by the Africa CDC as well. They are the ones that had put together the initial structure. They had been the ones also to put together the initial product assortment for the platform. So, I mean, we are excited about, this particular opportunities, but I suppose my message today is earlier than later, right? Because what we often hear, and this is not directed at any program in particular, but what we often hear is, we can do this with you, but you need to do X, Y, Z, or you need to arrive at this level of maturity. And my question often is, how do we arrive at that level of maturity if we don't get the support? To be able to arrive at that, we honestly need your support to grow this program. What we've been able to build has been a remarkable proof of concept that Africa in itself can develop programs like this and execute on these programs. What will be really crucial as we scale and build sustainably is to get this, pockets of support that will allow us to strengthen not just, the structure itself, the processes, the people, to position ourselves for even more impact, if you will. So I'm really excited with Ambassador Kengasong's confirmation about the opportunities that currently lie with the partnership with entities like the EMSP. But my message is the sooner the better. The sooner the better. Let's leverage the current gains and the momentum to drive forward. Yes.
Well, thank you very much. I think our presidents will be very pleased that they have a continent in very strong hands, and we're looking forward to mutual collaboration built on mutual trust. And I think what you're seeing here is when given an opportunity, Africa can and will stand up and be able to solve the problems that we confront. What we're looking for is just genuine partnership. What we're looking for is collaboration. And what we're looking for is an opportunity to be able to let what we're thinking of really be the best for our continent. So I think we couldn't have had a better panel than what we have today. Speed is of the essence in all of this. We don't know when the next outbreak is going to be. And we know that if something happens and you respond quickly, you're able to contain it. If you slow the process, it becomes more expensive, it becomes more difficult. And quite frankly, the best time to prepare for an outbreak is during the quiet time. So now's the time for us to get this done. And I really want to thank my president, President Bio in Sierra Leone, the lessons we learned from Ebola, the lessons we learned from these other outbreaks were effectively important in us getting the speedy response that you saw in Sierra Leone that allowed us to contain the outbreak, 4 waves of the outbreak, allowed us to have the least number of fatalities, the least number of hospitalizations because of this partnership, because of this collaboration, because of the strength and trust in the local people to look at local solutions. So thank you very much. Thanks to you all for helping us walk through this panel. Thank you.
Thank you.
Thank you very much. Thank you.
Well, thank you very much. To our panelists, thank you, sir. Honorable Minister Denby closed this out quite well. I definitely enjoyed the conversation that he held with Ambassador Nkengasong and Managing Director Efepe. Before we get into our next panel, I'd like to introduce a special guest that the Secretary acknowledged earlier. We are joined by Congressman Stephen Horsford, who is from the great state of Nevada. And Congressman Horsford has been doing quite a bit in his role in Congress, including working to crush the coronavirus, as is said here, and as we mentioned earlier, but also restoring public faith in government institutions, not just health institutions, but other institutions, in addition to focusing on recovery, which has also been mentioned as part of our conversation today. Just a couple of more details about the Congressman before he comes up. He has worked to really focus on veterans and seniors in the work that he does, and also has fought to protect a woman's right to make her own healthcare decisions, which we certainly appreciate here at home. Born and raised in Las Vegas to an immigrant mother, he brings a principled focus to Congress on job creation, community development, and skills development. And so with that, we welcome the Congressman to make a few remarks before our next panel. Thank you, sir.
Good afternoon. Thank you very much. It's an honor to be here, Mr. Secretary. Thank you for the opportunity, and it's an honor to join with heads of state from our friends on the African continent, together with the best and brightest in the United States to discuss strategies for our mutual and global success. As we learned with the COVID-19 pandemic, and as we have seen with many health threats throughout the ages, from polio to HIV, a robust health workforce is vital to protecting lives in all of our nations. As the incoming chair of the Congressional Black Caucus during the 118th Congress, which will start in January, I bring you greetings from the 58 members of the Congressional Black Caucus, referred to as the conscience of the Congress. We represent more than 80 million people throughout the United States, 17 million Americans. And we are committed to working with our partners around the globe and ensuring that the African continent sees the same kind of collaboration, partnership, and support that we have with so many other nations. In terms of protecting our health systems and infrastructure, we must have the trained personnel from doctors to nurses to researchers and other practitioners. And the people, your citizens, must have access. And that sometimes means bringing the healthcare services to their communities, especially those in remote and hard-to-reach areas. Here in the United States, we see that health insurance impacts the ability and willingness to seek care until it's too late. So we must create a healthcare environment that encourages regular health checkups and preventative care. Creating that kind of proactive healthcare environment will not only save lives, but it will also save money on treating more serious conditions that could have been prevented to begin with. Addressing this together, we can fight disease and close disparities around the world. And if we haven't learned anything else from COVID, we are only as healthy and safe as the most vulnerable people. So our healthcare strategies must help everyone if they are to be effective. Providing the care the most vulnerable people need will help reduce risk for all of us. And our battle against HIV globally continues. I want to commend President Biden, Secretary Becerra, and this administration who have committed to ending HIV and AIDS here in the United States and around the world. We have excellent treatments that are available now, and we need to ensure everyone who needs it has the access. And preventative treatments like PrEP medications must be made available to more people to stop the spread of the HIV virus. That is why sexual and reproductive health care for young people is also important. Giving people the facts about these issues will protect our communities and save lives. So again, thank you for being here today, for having me for this summit, which is incredibly important and an important moment in our time, in our history. And I look forward to hearing about the productive conversations that are had here on this panel today and throughout this summit. And I want you to know that on behalf of the Congressional Black Caucus, we look forward to your continued partnership. Our doors are always open, and we look forward to our mutual success together. Thank you.
Okay, well, thank you again, Mr. Congressman. And panel 2, don't be shy, come on up. I will be introducing our next moderator, Ms. Nardos Bekele-Thomas, the CEO of the African Union Development Agency, or NAPAD, and she has been holding that position since May of this year. Formerly, she was head and resident coordinator of the UN in South Africa. And before then, she held a number of senior roles with the United Nations, including in the Office of the Secretary General and with UNDP in Kenya. Not to be left off her bio, she also has served as a private sector policy advisor, which is incredibly important, as we heard from our speakers earlier. She's focused on the development and management of micro, small, and medium-scale enterprises, and in addition, has a strong belief in promoting women and youth. And so I want to acknowledge her and her work in partnership, both inside and outside of governments, with various sectors and organizations in the region and in the U.S., and thank her for joining us as our moderator.
Thank you very much, and good afternoon, everybody. You know, I think we rushed with time, but we'll be short, brief, and sweet, to the point, yeah? Well, we all know that, COVID-19 was really disruptive. But in the meantime, for Africa, in my opinion, it has also been an awakening call, because, for all what we have done, it's incredible the achievements that we have registered in a short period of time. COVID-19 response fund was put in place immediately to support pool production of diagnostics and other medical commodities by African CDC. African CDC was strengthened. African medical regulatory harmonization was established. The establishment of African Medicine Agency in September 21 is a landmark, and also the support to the manufacturing of vaccines. And we have got 4 countries that have really started manufacturing vaccines. And the Partnership for Africa Vaccine Manufacturing was really put in place. All these things happened in the last 2 years. And, we sometimes look at things, the glass half empty, but really for us, I see it as half full. Is it all done? No. The strengthening of the health systems and the ecosystems need to be looked at. We need to really foster and really have a very effective partnership. We need to have investment in our health systems and certainly in our health insurance and the entire health ecosystems. Well, I have got these 3 eminent people, and this is about you, not me, so I'll stop here. So, we have got, these 3 eminent people, speakers in the panel. We have, oh my goodness, yeah, first I will start with Minister, Honorable Kumbezi Kandodo Chiponda, who is the Malawi Minister of Health. And I have a question for you, Minister. Honorable Chiponda, Malawi has made huge advancement in improving health in the last decade, cutting in half the under 5 mortality, the mortality rate. And, congratulations for this achievement. In your opinion, what role has Malawi's investment in the health workforce played in such impressive gains? You have got like 4 minutes, I think. Yeah.
No, thank you so much for the question, and thank you so much, the organizers, for the opportunity just to interact with the audience. We don't take it for granted. Indeed, as a country, Malawi, we have come from far. We are not yet there, but at least something is being done, something right. In terms of infant mortality, indeed, we have moved from 52.4% to 29% per 1,000 live births. In terms of neonatal, 27.9 to 19.1. Like I said, it just shows that maybe we are on the right directions. I think we have been able to achieve this mainly because of change in policy direction. Now we have a community health strategy which we are following, but also we have a health sector strategic plan. The first one was from 2017. It finished this year. We have reviewed it. We'll have another one which is going to run from 2022 to 2027. But also other things which have improved, it was in terms of neonatal care. We have had to recruit more midwives. We have had to train more community midwife assistants as well, considering that 70% of our people, they're in the villages. So we need somebody on the ground to be there. But also, with the help of our partners, those who have spoken before me, including our presidents, they've already talked about, the prevention of transmission of HIV. It meant a lot to us. Most of our children, they were saved. Prevention of the mother to child. That meant a lot. All the interventions in fighting malaria, malaria is still #1 killer. The interventions which we're employing, thanks to Global Fund, we're able to distribute 9 million nets. Each and every pregnant woman in Malawi, when they go for antenatal, they get a mosquito net as the part of the intervention. So these interventions, with the help of our partners, they're really, yielding the results which we are talking about today. Also, immunization. It is mandatory that all the children in Malawi, they get immunized with all the different types of immunizations which we have in Malawi. So with the help of our partners, we are able to do this, and that is why, we can see improved indicators when it comes to neonatal, when it comes to under 5. However, I don't want to dwell on the gains. I want to dwell on the challenges which remains there. Because to me, what really bothers me is that I have this baby. We have invested so much in terms of preventing the mother-to-child transmission. I have this baby, which all of us invested so much in terms of immunization. I have this baby. We have fought so hard to give the mosquito net, and then only to have that child succumb to pediatric cancer. Because I don't have diagnostic centers in Malawi, because I don't have a trained nurse, a specialist nurse in Malawi, because I don't have a national cancer center. In terms of cancer center, now we are constructing one. We are yet to put the backers, but now I have to talk of specialist services being available. So that is why I was very, very, happy with the topic partnering for sustainable health. Because sustainable health, it means we have this child who we have done a lot to make sure that this child from 1 to 5, she is okay or he is okay. How do we see this child through adolescence? How do we make sure that they don't get pregnant when they're young? How do we make sure that she stays or he stays in school and becomes an adult? How do we make sure that when they have some other issues of mental health, I have the specialist services to offer this child? Because of different reasons, all of us now are struggling with mental health. And yet we see less investors interested in mental health. So to me, what would really make a difference is to have partners coming into Malawi. What is it that we do? Do we partner with the government or private sector to provide diagnostic centers which we can, test our children, to provide, social cycle services to our adolescents, our youth? That kind of support is that we need. So I think my
Thank you
time is
so
up. Let
much.
me stop there. Thank you.
Thank you very much, Honorable Chiponda. Certainly, the promises of Malawi, regarding universal health care, has been fulfilled. It was accompanied by action, by planning and budgeting, but more needs to be done in terms of building the ecosystem. To you, Dr. Gwande, given your unique vantage points, leading USAID's global health portfolio, I'm just curious to hear your perspectives on the US government's partnerships with governments of Africa in support of the health workforce.
Thank you for,
More specifically, how is the United States working with the countries in the region to support the African health workforce?
excellent. Thank you for that opening, and thank you to Minister Chiponda of Malawi. This is such a great example. In the last 20 years, Malawi has raised the life expectancy of a human being from 47 years to 65 years. In the space of 20 years, raising the life expectancy by 18 years. I mean, that is just incredible.
Yeah.
And it is still a state of affairs where it is unacceptable to have a 65-year life expectancy in a world where, with adequate public health and appropriate health access to health services, you can live 80+ years life expectancy. And that is the measure still of the equity gap. Now, the gap here is measured in the health workforce. A quarter of the global disease burden in the world is in Africa, where there is only 4% of the global health workforce. You cannot close that gap without addressing and meeting the needs of that global health workforce. The region, the African region, requires, in order to meet the SDG goals for health, like the levels of basic achievement in child and maternal mortality, the gap is 5.3 million health workers, and that's nurses and doctors, that's community health workers, it's epidemiologists and laboratorians. It's the basic system of care that's lacking there. I want to be substantive about what we want to do as a U.S. government. We have completely backed the idea that that enabling that workforce is foundational to our efforts of what we've done, and across the U.S. government, not just USAID, but also including the President's Malaria Initiative and PEPFAR. We spend about $1.3 billion annually on supporting and enabling the health workforce, either directly, salary support, but also through training, technical assistance, and upskilling so that people are able to function in better and better ways to support health needs. In May this year, because we've seen not just that we have this gap to go, but we've also seen substantial losses under COVID because of the damage to already fragile health systems from COVID. The President Biden and Vice President Harris announced a global health worker initiative to put investments into further strengthening and protecting that health workforce that is so critical. As part of that, we are also aiming to sustain and improve our investments by working with Congress to program at least $4 billion of investment in health workers as part of our global health efforts by fiscal year 2025, and with better coordination with regional and country health workforce priorities across the USG. For example, your discussion of wanting to better support community health workers. We know that what it takes to be able to achieve this work. First of all, it's tighter alignment than we've had with our partners, our regional partners, including Africa CDC, the African Union, and WHO AFRO. And we are committed to doing that, and we have worked with them closely to also achieve a particular emphasis in what Director General of the WHO, Dr. Tedros, called a radical reorientation of health systems towards primary health care. This is crucial. Why? Because the evidence indicates that a health system anchored by a strengthened primary health care system delivers the results we need for lower mortality, improved equity, and gender inclusivity, and also increased cost efficiency. So as part of our work, we are therefore joining with the goals of African Union and Africa CDC and WHO-AFRO to support that community health workforce and the upstream investments in primary health care clinics. And USAID is announcing today, as part of that, our commitment to accelerate primary care by coordinating our vertical global health investments across all of our work in 5 focus countries in Africa. Those 5 focus countries where we're starting, and this is to coordinate across all of our USAID global health investments. Thank you to David Walton, who's here from the President's Malaria Initiative, also with PMI, in Cote d'Ivoire, Ghana, Kenya, Nigeria, and in Malawi. In addition, we have the support of John Nkengasong and PEPFAR to include PEPFAR investments in Malawi as our anchor place to prove that we can all work together in collaboration to create a better foundation of a primary healthcare system. And just last month, I also got to announce that we're coordinating these investments with the Global Finance Facility so that we're all working towards one primary healthcare aim. And so with that, I hope we will be showing they'll be delivering concrete, visible progress in the months ahead for the Africa region, starting with these 5 countries and then expanding from there.
Yeah, thank you very much. Thank you so much. Thank you very much. So, I'll go to Dr. Ayoade. Dr. Ayoade and Dr. Alakija. Yeah.
Just call her Yodi.
Yeah. Yeah. Oh, that's it. Yeah.
Yodi. Yeah.
Okay. Why is promoting a robust health workforce so important for Africa? What types of partnerships are needed to support a sustainable and robust workforce across Africa?
Thank you very much. And also I want to add my congratulations to the Secretary of Human Health Services and to the team for putting this together, and also to the US government for having us all here this week. I think really my colleagues have said it all. I mean, the imperative is clear. We need to improve, and we need to go beyond what Atul just said. Only 4% of the global health workforce are in Africa. But I think also we have to recognize that not only do we not have enough people trained, we're also, those that we're training, we're leaving. We're losing. So we need to look at retention. How do we retain the health workforce that we have, as well as upscaling our training? How are those investments that you're making in training people not going to mean that those people, because of course we have to balance retention with free movement of people according to the WTO imperative, so those people are also free to leave. I'll give you an example. The University College Hospital of Ibadan, which is where I trained as a medical doctor in Nigeria, about a month ago, the chief medical director raised an alarm and said that he has lost 661 doctors and nurses this year alone. That is one hospital. So the retention, I think, and the investments have to be in ensuring that the health workers that we are training, and it's wonderful to have investments, and really welcome the announcement today of the $4 billion by 2025 for health care workers across Africa. Welcome the 5 focus countries, and thank you for that work. But we also have to begin to look at, thinking strategically about how we sustain those partnerships and make them true partnerships, how it doesn't become the sort of, well, we're going to give you money to train healthcare workers, or we're going to send you healthcare workers. My seminal work, my first job ever, was in the Pacific Islands. I was regional health coordinator for the region, Pacific region, and what we did there was develop a cadre, a health workforce, and my job was to produce that curricula to train Pacific Islanders for the Pacific. not train them to export to Australia or to New Zealand, which is the immediate export market, but to train them for the Pacific, to train them with specific skills that were local and that ensured that their skills were I mean, not that their skills were not transferable, but their skills were it was local solutions for a local problem. And you know, look, right now, it's very clear that with the geopolitical shifting sands, Africa has become a much sought after strategic partner, not just in the health space. You know, we've heard brilliantly from Chidinma earlier today about what's being done with the medicine supplies platform. As she said, proof of concept, but it shows that we can do this. And as the second largest continent in the world, it is indeed time that our voice and the voice of our leaders and our health leaders are also heard on the world stage. So whilst we welcome the efforts and the conversations around partnership, we must speak now about the practicalities of those partnerships. Yes, we recognize that most of the health workers are women as well. 70% of their health workforce, bless you, are women on the continent. What are we doing to protect those women's rights? What are we doing to protect their ability to work? What are we doing from a gender perspective? So we need to move beyond the siloed approach of a health workforce or you know, we're training, you know, people for TB or malaria, but we need to think more across the board. How do we look at the holistic definition of health? How do we train women and girls across the board? How do we put that investment of 12 years in a girl's education to make, because that is the greatest investment of all. That will mean that, number one, that girl can enter that health workforce, but it will also mean that our investments in preventing disease, that sense of wellness, is therefore protected, because of course, you know, on this panel, you are totally outnumbered, my friend. You know, you train. So this
70%.
Yeah, this is a girl power panel, and I'm sad that our presidents have left, because part of my challenge is also to the leaders of Africa. So those of you who remain here, who are ministers, and I'm delighted that my sister Jane and my sister Dr. Chiponda, that we have ministers here who are women, that we need to champion women on the continent. So for you, my Iyawo, Nados, for you with your role at the Africa Union as well, the very basics of our health, the very basics of our training of our women and girls, and investments in their wellness and investments in their education is really where we're going with our investments in health workforce. So I think let's go back to the basics and let's look at the partnerships across the board that help us to deal very, very, very practically with those basics. Partnerships that are not paternalistic, that are not patriarchal, but partnerships that are respectful, partnerships that have us looking each other in the eye and not having somebody looking down on us. We've heard a lot about that today. So this is a short time to make that argument, but we're very grateful to the US for this. And my final pitch is that, you know, the US-Africa Summit is wonderful, but perhaps, and also for you as AU, perhaps, and President Orama here of Afrexim, maybe let's throw this in your basket as well, that at the edges of the next AU summit, maybe in a year's time, let us invite the leaders of the world as well to come into our backyard. And let us have 2 days of extra sessions where we welcome the world so that they can meet us at home.
Thank you very much. Thank you so much. Please give them a round of applause. Yeah, truly, you know, in order to build our workforce, first of all, we have to really create that conducive environment to retain our doctors. Our doctors, many of them are abroad than in our own countries. So we have to interrogate ourselves and ask a question, why are they leaving us?
That's right.
Okay. The second thing is build the capacity. First of all, when we do planning, do we really talk to our medical schools how many doctors we need and how to train them, what the skills are required to deliver the plan that we are putting? Because projection tells us what the population would be in the years to come and how many doctors we would have, what infrastructure we need, what kind of system we need in terms of health sector. So planning is very important, but you have to plan it with the institutions, research, you know, and also learning institutions. It's very critical and very important. And also budgeting, investing in people is the most important thing. Investing in human capital is critical and very important. And we always look, you know, outwards for support, but that is where our money should be. And I would really like to thank you, especially you also, for making sure that the promises are followed by action in your government, in the primary health care, and for showing results. for showing results, and that is caring. It's very critical and very important. And finally, I would like to say thank you to the government of US for this occasion, and we would like, as African Union, to work with this, of course, America. We have John here, who is really, a member of the AUDA, and I'm so grateful to him. Afrexim Bank is our partner, and all the business sectors. But let's also promote private sector to invest in healthcare. To invest in healthcare. There is no need for Africa to go elsewhere. We can build, all what it takes to make sure that our population live in a healthy environment. Health is security. Health is a human rights. I thank you. Thank you very much. Thank you so much.
Thank you.
Thank you, Madam Bekele Thomas, Minister Chiponda. Very nice seeing you again, Dr. Kiwande, and also, of course, Dr. Alakija. Really great and energetic panel, which is hard to do at the end of a session. I have the pleasure now of introducing everyone to some of our closing speakers. First, I know that we have talked a lot about the Africa CDC, and I know that they are in the midst of their own convening in Rwanda this week, but we do have a special message from their acting director, Dr. Ahmed Ouma. With that, I would like for us to tune in for his remarks on the screen. Thank you.
Your Excellencies, our heads of states from Africa, our co-host, Secretary Becerra, all ministers, heads of institutions that are present here today, I send you very warm greetings from Africa. At Africa CDC, we take our mandate of safeguarding Africa's health very